I moved out here. I wanted a new change, and I came here, and everything I thought it was gonna be everything I thought it was gonna be, it wasn't at first. It just seemed like things was closing in on me. That's how I winded up sleeping in my van. Kind of like just slept just like this, just crossed just like that, and I kept my head down, so no one could see my head. And sometimes I would switch back to the other end. It was kind of uncomfortable. Sometimes I would put a jacket or something up under my side. Well, the normal rating of your blood sugar should be around 80, 120, somewhere up in there. But mine was unfortunately 566. So that was out of control. I could have went into a diabetic coma and, possibly death. That's how I ended up here at the emergency room at Allenmore.
They were able to give him insulin and bring his blood sugar down. He was not so sick that he needed to come into the hospital, but it was, I think, a wake-up call for him. And so he was able to come and get established here at Tacoma Family Medicine shortly after that.
And I said, Dr. Snowmassar, is there any way possible that you can give me some resources where I can get some help? I'm homeless. I'm sleeping in my van, and at this time I don't have a job or anything.
In Homer's case, he was on insulin. Insulin requires refrigeration, and trying to meal plan or kind of count carbs and administer insulin in a situation where you're not even sure where you're going to be sleeping that night is next to impossible. You put anybody in that situation and they're not going to do well.
He said, Homer, I'm going to reach out and see what I can do to help you. And that's how I met PHP Anna, my personal health partner.
And I asked to set up a meeting with him, and I would meet him out in the community or he could come here. So he agreed to come meet me here at Tacoma General by the fish tanks.
All of our staff members really sort of become social workers, part-time social workers, and so we see everything from homelessness to food access issues to financial issues. We see really across the social determinant spectrum. We deal with varying issues on a day-to-day basis that are more social than clinical, that drive patients to come into the emergency room and into the hospital.
He said something about Christmas being his birthday, and I just looked at him and I'm like, well, you can't be homeless for your birthday on Christmas.
And she gave me some job leads on where to go. And I'm like, okay, Anna has a very strong point here, because if you don't go get a job, you're gonna be broke for your birthday. So I left from there right then, and I went and got that job. And I've been there ever since.
There's not a lot of housing available. Most of them have a 2-year wait. So even knowing that, I had to think outside the box. And so I did. We got on social media, and we found some different places that would accept him without having 3 times the rental income.
Now that I got, housing, I'm doing better and I feel better. So I'm just thankful for MultiCare. I love the MultiCare family. I love you guys.
Being a nurse by background, what makes me want to come to work are the stories like Homer's. We get a chance to do what's right for the patient.
That's my goal with Homer, is to get him kind of continue to work on getting to his goal of being healthier and living a long life, and get his diabetes under good control.
I'm thankful that I was able to overcome that situation. And I just want people to know that there's hope. There's hope. Don't give up on hope.